Hello everyone. So this is going to be a summary of the classification of bones. First of all, we can classify bones according to region, to the axial skeleton and appendicular skeleton. The axial skeleton consists of the skull, the vertebral column, the ribs, sternum, hyoid bone in the neck, the face and auditory ossicles. Face bones and auditory ossicles. And for the appendicular skeleton, it consists of bones of both upper and lower limb, the shoulder and pelvic girdle, the clavicle, and the scapula. Secondly, we can classify bones according to shape. We have long bones, short bones, flat bones, irregular bones, sesamoid bones, sutural bones. The long bones are taller than wider. For example, we have the humerus in the arm, the femur in the thigh, ulna and radius in the forearm, tibia, fibula in the lower limb, the metacarpals and phalanges, which can also be classified sometimes as long short bones because they are a lot shorter compared to the humerus and femur and other long bones. So the short bones are cube-shaped with vertical and horizontal dimensions approximately equal. We have, as an example, the carpals and the tarsals. Then let's move to the flat bones, and they are two thin plates of compact bone with spongy bone in between. For example, we have the scapula, the ribs, the sternum, the frontal bone in the skull. Then, the irregular bones are bones that have a lot of irregularities in their shape. For example, the vertebra, the maxilla, the mandible, the sacrum, and the hip bone. Some books would say that the hip bone is flat, and it just depends on where you are or the university you are learning in. In my university, they consider the hip, they take it as an irregular bones because we take it as the hip bone has more irregularities than a flat shape compared to, for example, the scapula. Then let's move to the sesamoid bones, and they are bones which develop within tendons, and the most known example is the patella of the knee. So the patella develops in tendon of quadriceps femoris, and we have another example which is the pisiform, and the pisiform develops in tendon of flexor carpi ulnaris. Then we have the sutures, which are the bones located within the sutural joints between the cranial bones of the skull. Then we can classify bones to histology, to compact and spongy. The compact is dense and it's solid. The spongy is trabeculae and it contains the bone marrow. Next, we can classify bones also according to development. So there are the bones that develop by intramembranous ossification and endochondrial ossification. We have supernumerary bones accessory bones, pneumatic bones, heterotopic bones. So for the intramembranous ossification, we have the bones of vault skull, face, and clavicle. Endochondral ossification, bones at the base of the skull and long bones. Supernumerary bones are extra bones, so not all people have them. For example, the sixth finger. Then accessory bones like the cervical rib, the lumbar rib. Pneumatic bones like the maxilla. The heterotopic bones like the rider's bone in thighs or in buttocks. So they are not really bones, but they develop in a way that they become so solid like a bone. Next, we have the functions of bones. So the bones are really important because they protect our vital organs. Like for example, our rib cage protects the heart, the lungs, and some other organs. They are levers for muscles, so they allow movement. They are mineral storage, especially for calcium and phosphorus. And the blood cell formation occurs within the marrow cavities. Then I have the structure of a long bone. So the long bone consists of a diaphysis, which is the shaft that forms the axis of the long bone. It is composed of compact bone that surrounds the medullary cavity, and the yellow bone marrow is contained in the medullary cavity. Then the epiphyses are the ends of the long bone. We have a proximal epiphysis and the distal one. So exterior is compact bone, but interior is spongy bone with marrow. And the articular surface is covered with the articular hyaline cartilage. And metaphysis is the part that is between the diaphysis and the epiphysis. So we have the epiphyseal disc. It separates the diaphysis from the epiphysis during elongation of bone, and after the finishing of elongation of bone, it is called the epiphyseal line. So lastly, I have the structure of other bones. They are externally compact bone covered with periosteum, internally spongy bone covered by endostem. Other bones have no diaphysis or epiphysis, and they contain the bone marrow between the trabeculae. Thank you. I hope you have a good day.